There is a question says Propylthiouracil is prescribed for a patient with Graves' disease. The nurse should teach the client to immediately report which of the following. So there's option sore throat, painless excessive menstruation, constipation, or increased urinary output. So I'll tell you the answer, that is sore throat. And why? Because it's a classical symptoms of having infection in the body. So why the symptoms of it? It's a symptom of having infection. I'll tell you about I'll break it down the question. So first of all, we'll see two things in this video. First is Graves' disease. What is Graves' disease? And what is Propylthiouracil? We all know Propylthiouracil, that kind of a drug. Graves' disease kind of a disease. So Graves' disease, what is it? So it's you all need to know about two things only. So it's a chronic, and second is the autoimmune disorder of what? Of thyroid gland. What it does? So it stimulates the thyroid gland to produce more and more thyroid hormone, and produces too much thyroid hormone. It also known as hyperthyroidism. That was about Graves' disease, that is known as hyperthyroidism. Second is PTU. The PTU, Propylthiouracil, it is an oral antithyroid medication. What it does, it blocks the production of the thyroid hormone from the thyroid gland. What it can do, so it cannot alter the existing hormone. So जो भी produce होगा in the body, जो भी existing hormone है in the body, so it cannot alter that. It can only blocks the production, right? Why we give, and what is the preferable time to give the PTU? So it is preferable in the first trimester of the pregnancy, because it is less fatal. It is than the methimazole. This is methimazole. This is the first line medication for the overproduction of the thyroid gland, for the hyperthyroidism. कि बहुत सारा thyroid hormone है in the body, तो we give methimazole. अगर methimazole is not working correctly in the body, कुछ होते हैं patients की they have allergy with the methimazole, so then we give PTU. And also we give PTU in first trimester of the pregnancy, because methimazole has lot more adverse effect than the PTU during the pregnancy, क्योंकि वो death defects ऐसा सब करवाता है इसलिए. And thyroid storm है तो भी हम देते हैं. Thyroid storm meaning कि बहुत सारा thyroid hormone है in the body, बहुत सारा. It's a life-threatening condition, by the way. So when are we giving PTU? What are the symptoms we have to observe of? As a nurse, we should all know that कि liver damage करता है this medication, and also agranulocytosis. We'll talk about it. So liver damage, though we all know the signs and symptoms of the liver damage, कि jaundice जैसा होता है. First of all, dark urine ऐसा हो, light colored stool, abdominal pain mainly in the upper right corner, yellow skin, eyes हो जाता है. Agranulocytosis, what is that? It is a rare though. उसमें the drops of the WBC, and symptoms will be fever, chills, and sore throat. So this is our option, sore throat, and we should immediately report. So let's go back to the question again. Propylthiouracil PTU is prescribed for a client with Graves' disease. Now we all know what is Graves' disease. That is the overproduction of the thyroid hormone. So body में बहुत सारा thyroid hormone है, इसलिए हमने दिया Propylthiouracil. So as a nurse, what you should teach the client, कि अगर कुछ हुआ, what the patient should immediately report. Why should the patient should come to the hospital or call the doctor अगर कुछ symptoms हुआ तो first step the first है sore throat. Why? Because it's the symptoms of the infection. उससे पता चलता है कि patient में body में कुछ गड़बड़ हुआ है, infection कुछ हुआ है. तो अगर patient आया hospital में तो you do a blood culture, blood work कराओ. अगर कुछ causative agent है तो you treat with that particular medication. That's it. Thank you for watching. Bye bye.